Dr. Francavilla. We're here with our patient to do an implant procedure. We're going to be using the small diameter implants. We're going to try to put some implants in, and by using the implants we can again get that nice kind of fit for the lower denture. So that's basically the process today. We're going to be putting 4 implants in, and then we're going to be putting the overdenture onto this. We're going to try that denture on, make sure that everything is where we want it to be before we get going. So let me put this in. Okay, good. Alright, now just chop down. Very nice. Now, as it sits, it feels comfortable when you're closed. So we're in good shape. This is a denture you've been using, so we don't have to really do a lot of extra adjustment on it.
With surgical template in place, entry points for implants, or pilot holes, are marked with a marker or by bleeding points using a perio probe to measure gingival thickness. The surgical template is removed after only a short penetration of bone has been achieved.
We'll use the Okay, now I've just encountered the bone, and we're just going in easily. It appears as if the bone is pretty good. It's pretty dense, which is what we're looking for. Okay. Now I'm going to just bathe this a little bit with some cool water. Keep the area as cool as possible. Okay. Now we've cooled down both the drill and the implant. Just a little bit of refrigeration.
Implants may be previously chilled to be ready for placement. Then remove them from the vial, grasping it by the plastic holding cap. Insert the implant into the pilot hole through the attached gingiva and rotate it clockwise while pushing with downward pressure. The holding cap will break free, exposing the implant head. Engage the finger driver into the head of the implant, rotating clockwise with a downward pressure that continues the self-tapping process. Check the alignment for desired angulation to give a path of insertion for the overdenture later. Bone should feel reasonably firm. When noticeable resistance is encountered, proceed to the next driver tool. The winged thumb wrench allows greater torque to sink the implant deeper. Always use a downward pressure with reasonable force. Turns should be only 1/4 advancements at a time, giving some time for the bone to rebound and the heat to dissipate. The ratchet wrench is used with small incremental turns for the final seating of the implant.
The finger driver has a square hole to engage the square area here. Okay, we've engaged that. Just twist easily with a downward push. He's got good bone, so getting a fair amount of resistance with this tool. However, okay, I'll change to the next tool, which is a little bit easier. Gives us a little more advantage. It's the winged thumb wrench. Again, we will engage the square area, and that will allow us to turn this now. As we're doing it, we're going to just do a little turn at a time as we press down. Give the bone a little chance to rebound. There's no hurry. Okay?
Oh, yeah.
And go to the ratchet. That'll get us a little farther in, and then they go back to the wings.
I didn't know you had to be a mechanic.
That's true. True. Okay, now we're going to put the block-up shims on. We've done the block-out shims for these, and now we're going to do, we've just put this one on, and then after the block-out shim will come the last housing, which we'll put on here. Okay, housing slips over so that it engages the block-out shim. Okay. Into the denture. Okay, and then I'm also going to put some right around the housings themselves. The denture in. Okay, thrust your tongue forward and back out. Beautiful. Okay. Bite down. Okay, 5 minutes have gone by. Let's take a look at this. And what I'm going to do to help loosen this, I'm going to blow some air down at the border. I'm blowing the air down at the border. Any vacuum that we may have from the reline will be relieved, and it'll make our job of getting this out easier. There we go. Okay. Alright, there's our denture. There's the housings, 4 of them. They fit on. Now let's put this back on. There we go. Okay, bite down. How does that feel, Bill?
It was pretty good.
Okay. Does it feel sturdy, secure?
It was so strange because I didn't have nothing for it.
That's right. You've had nothing, and this is kind of neat to have those teeth back, isn't it?
Well, yes.
That's great. Okay, good.
Can I choose peanuts?
You can chew anything you want.
No.
No, listen. Now here's what we're going to do. I'm going to have this, keep this in for 48 hours, 2 days, okay? Don't take it out at all so that the gums heal around it. We don't want the gums to grow over that, okay? Then, I'm going to see you after that. We'll take a look if there's any sore spots or things of that sort. We'll take care of those, okay? I want you to pretty much eat almost anything you want to eat because we're going to test it out. We're going to see what you can do, okay? I think that's important. And this way, when you come in, you report to me what you're doing, and we'll go from there, okay? Very good, Bill. Okay, we're set.